Thank you very much to this group for the warm welcome at my first INRICH workshop today. Thank you to Maria for the invitation to speak with you. And it's definitely been a day of very high quality presentations. And for a researcher who tends to lean to the qualitative, frankly, quite scary statistics. So no questions that are too hard, please. Now, people have looked at my badge and they've said, oh, UNESCO. And I think Maria wanted me to just say a little word about what the UNESCO chair is. So a UNESCO chair is a UNESCO collaborating centre. And some of you have sort of said, oh, does it come with money? No. Sorry. The good news is that if anybody in the audience is thinking about that they might like to establish a UNESCO chair, there is a procedure for doing it. There are only 25 in the UK, for example, at the moment on a varied subjects. The bad news is it does not come with any money. You get a logo, and I have got on quite a nice badge that I forgot to bring today. The history of the chair is that my wonderful colleague, Professor Didier Jourdan, who may be known to those of you who have spent time in French public health history, he's at the University of Clermont-Auvergne, and he established this chair in 2018, and the first mandate he brought in a considerable amount of funding for the activities and a secretariat. So it's actually quite a well-developed UNESCO collaborating centre. You'll notice from the logo that I think it's unique worldwide in that it's also a WHO collaborating centre that Didier also chairs. And I've come in, we made a joint application for the second mandate. So I am an academic pharmacist by background, which usually gets people putting their head on one side and looking at me when I go to adolescent health meetings. But I fell into adolescent health 25 years ago or more, coming to do a PhD as a community pharmacist, getting really interested in where young people were getting their information from before they came to see me and to ask for advice. And that is how my interest in health literacy and medicines literacy indeed has developed. So over that time, I'm also the Vice President for Europe for the International Association for Adolescent Health. I'm very privileged to be a trustee of the UK Association for Young People's Health, and it's a really multidisciplinary environment, and I love it. So, yes, today I'm going to talk to you about health inequalities and the school setting, and it's going to be a talk of two pieces, not quite two halves. I'm going to take you on a roller coaster tour of some literature review that I did for a project that I'll tell you a bit more about, and by the end of that you're probably going, so after that, I'm going to come back to some work that Didier has done, which is much more measured and which will give us hope for the future, I am sure. So it's a talk of two pieces. Okay. So as far as the chair is concerned, just as far as our mission is concerned and our strategy, we are rooted in this field of health promotion, health education and prevention. We're looking at coordinated intersectoral actions. So for the chair, I bring healthcare. Didier brings public health and education, having been a teacher in his first career. So we're trying to orient and support social change in order to improve health for all and reduce those intransigent health inequalities, so by action on life ecosystems and lifelong learning. And if we look, of course, we are UNESCO, and the focus is on children and young people, and you can see their schools as part of that ecosystem, but as so many people have said today, those links between other parts of the ecosystem we'll come back to later. And our vision has been to create conditions for children and young people to take charge of their lives, and not only as individuals, but as members of their community and as global citizens indeed, for all matters related to their health, and health being a very broad term. And really one of the things that we're most proud of in the first mandate of the chair was it equates to a mission statement in Lancet Child and Adolescent Health, supporting every school to become a foundation for healthy lives, which had a global authorship. We were delighted, so please do have a look at that at some point if you can. But today, I thought I would take you through a journey that I had for a review and a report that we were commissioned as the chair to work with the Crèze-Baca region around the beautiful city of Marseille, a region of great diversity. And I decided, and convinced Didier, that we would have a look at health inequalities literature around Maslow's hierarchy of needs. So trying to look for papers in the health promotion, health education and beyond sphere that talked about different levels in Maslow's hierarchy based on the premise that if these needs are being met, that children and young people are ready to learn and to be a good citizen. Okay, so the background to this review was that it was done to present it to a very diverse group of stakeholders in the Creux-Pacard region who came from health and education and social care, and to get them talking about what could happen in their schools. And the project continues. I'll tell you a bit more about that at the end. So let's start at the bottom of the pyramid. We're going to go, whoo. So we'll start with physiological needs. So I did some searches related to water. Actually, before I go any further, I should say that what struck me, and this has been the perfect community to talk to about this, is that when people are doing these intervention studies, and it was more than that, reviews and reflections, people often don't look at health inequalities as part of their analysis. And so, you know, for this community, I think we're well placed to try and say this is a fundamental need, that as people are moving forward with interventions, we need to know about inequalities. And the other thing that I should say, and I have a map at the end that I'll keep if anybody wants to look at it, is that most of the inequalities I will talk about will be regarding socioeconomic status. I'll say SES, or else I'll go over the 20 minutes. But there will be some other types of health inequalities that I'll point out along the way. So when we're thinking about water to drink, interesting study by Ramirez and team about the unintended consequences of mandating the provision of water with school meals as part of an anti-obesity intervention, because it could increase health inequalities for those schools where, quite frankly, the tap water was contaminated. And this was a study undertaken in California, so let's not have any assumptions about where these particular problems might exist. But also, really importantly, about water to clean with. So, you know, thinking about water, sanitation and hygiene systems, the wash systems in schools that need to cater for the needs of girls while menstruating and students with a disability. Otherwise, there are gender inequalities and inequalities around students with disabilities that can ensue. If we move to food, there are many papers about the impact of the school as a food environment, and the different aspects of food provision that have been studied in the papers that I found were school meals, also school snacks in a much smaller volume, and about the retail food environments that were clustered around schools. And, you know, really the link between food and education studied is twofold. It's, you know, if a child is not hungry, then again, it's meeting one of those needs and making them ready to learn. But also there's an opportunity there to optimise children and young people's diets, to extend their repertoire, to expose them to food systems and thinking about, you know, the growing and the sustainability of food as well. So going into some of the papers found there, we saw, I found on my travels, positive effects among low SES students about breakfast initiatives, so hoping to reduce some inequalities. Mixed findings about health inequalities' impact of free school meals. A really interesting study about the impact of canteen staff on reinforcing social inequalities, and human resources is something we'll come back to. And this was really about the canteen staff in canteens in schools where the students tended to be more middle class, tended to be more white, would take on this kind of caring mother role, and that they found in other schools which perhaps had more children from ethnic minorities, lower SES, you know, they'd find there was kind of tough love going on with the canteen staff about what they should eat. So, you know, inequalities popping up in the most interesting of places. And similarly, thinking about schools and where they were and the food that were available in those schools, you know, this kind of school identity that we have poor food, you know, coming from other papers. An interesting paper about the negative effects of children from lower SES backgrounds who have mostly better off peers, and the fact that they tended to snack more. So again, this is not exhaustive nor systematic, but I'm hoping that it shows you that, you know, beyond where we think that there is literature. There are some really interesting, clusters of papers. Another fascinating study about allergen control plans. So Fermadas et al. Talked about, putting things in place to make sure that students were, able to navigate their way around a school menu. And they found that it did reduce inequalities because the impact was greatest in small schools and in low SES areas. And then a large number of papers, and I'm sure since I originally did this review, many, many more now about the impact of COVID school closures on food insecurity. And the Akesh paper is about South Sudan. So, I mean, the papers that we were finding were truly global. Interesting notes. I'll tell you a bit more about where you can get the list at the end. If we look at sleep as being another part of this basic physiological need, interventions regarding sleep are not referenced in many papers. Sometimes they're there in combination with other things. So there are EBRBs, energy balance related behaviours, and you can see that sleep is alongside things like tap water, fruits and vegetable consumption in studies like the EPOSE study. But a really interesting study by Ribeiro about sleep deficits and finding that sleep deficits were greater in children from lower SES backgrounds, and actually reflecting on sleep as a pedagogical tool by looking at things like later opening of schools, later start of lessons, and also using naps through the day. So again, these are basic needs, people doing some really interesting work and talking about inequalities. If we move on to other aspects of this first pillar, low SES schools were experiencing more exposure to air pollutants because of where they were, the industrialisation, the urban nature of them. Some interesting papers, contrasting results about the idea of uniforms. Now in the UK, most of our high schools have uniforms, and most of our primary schools actually as well, but I know that there's great variation. And so on the one hand, Gasson was finding that the cost of uniforms could impact on inequalities. If you weren't able to afford new uniform, perhaps you had to go to the second-hand store at the school to get your uniform, but also then Wu and bringing out that uniforms themselves can reduce those socioeconomic differences. There's no pressure to wear the brands, which trainers have you got, things like that. So clothing in that way is an interesting area again and might make a difference for students. And then I just wanted to pause a moment to think about school toilets, okay? And I'm hoping that you're not going to go back here to try and think about your experiences. Mine were pretty grim, and I think most people's were. But again, interesting, and we had an international association meeting in Athens last year, and somebody took a whole session to just talk about school toilets, right? So, for me, it's definitely an area that needs work. And the inequalities, there was a gender inequality here in this study, talking about inappropriate toilet use for urination and really referring to the fact that there were a lot of girls who were not urinating during the day and did not feel that they wanted to use the school toilets. Now, interestingly, there's a high school near us that has recently had a modernisation. And I think they've moved forward in a really interesting way, and they've really taken on board the idea of kind of gender-neutral toilets, building kind of cubicle-style toilets, where students can choose to go and are unisex. But she was quite surprised when she took her daughter to see that they'd taken all the doors off the front of the cubicles. And when she asked about that, it was because they said that the Year 9 students, which in the UK are about 14-year-olds, were having sex in those toilets. So they decided to take the front doors off. So the unintended consequences of, trying to innovate in terms of washrooms is an area that, is a very interesting place for exploration. Well, not too close, obviously. Now, moving to safety needs. This takes us into environment and accidents, and this is where Maslow themselves put health and well-being. So if we're thinking about the environment and thinking about violence, which is central to the theme and the discussions today, it's been, many people have reflected on the fact that, a violent experience in school can shape future trajectories, and my literature tour says the same. There was an interesting paper about school discipline and school surveillance in terms of racial inequalities. So, for example, there was a very interesting paper, I think it was the Kupchik paper from the US, where they were pointing out that discipline that involved suspension from schools was being applied disproportionately to students from ethnic minorities, and therefore these children were out of school. So, it was doing precisely the thing that we didn't need as far as inequalities were concerned. And in fact, they called it the school-to-prison pipeline, was a phrase that they used in this paper. So, school discipline and surveillance, and again, coming back to human resources and policies is something that we'll reflect on. And then, again, another thing that you'd think, well, that's fantastic, active school transport. Well, okay, it seems in principle like a great idea, but what if you live in a neighbourhood where your pavement's in desperate need of restoration, or that the traffic is unbelievable and we're thinking about children walking to school or cycling to school, and then actually, there are possible inequalities that will come there from those more deprived neighbourhoods, just for the thing of trying to get their children out and more physical activity. We had some excellent talks about bullying and indeed safety in school. There are papers that were showing inequalities in terms of sexual orientation, race, ethnicity, migrant status, and gender, and it's a huge theme. And then we look at things like organised sport injuries. Okay, so organised sport, again, fantastic, physical activity. But it does have an inequality that can be in there, because actually boys tend to be injured more often in organised sports than girls do. So, there are some reflections there about the activities that are available. And of course, injuries and accidents are, a major cause of morbidity and mortality in the world's adolescents. So, should not be underestimated. Many intervention studies exist about healthy diet and physical exercise. So this was one place where quite a few of the authors had reflected on health inequalities. There are mixed findings, and some can increase the gap, and that might be the gender gap, for example, or youth who do not like the idea of going into changing rooms, and again, thinking about gender identification. Some studies can reduce inequalities, and the Van der Ploeg, I'm sorry, I've probably said that awfully wrong, study was interesting in that it was, and perhaps this is a principle that we can bring out, it was quite a comprehensive intervention, and it involved having a school health counsellor in the school. So it was not just about healthy diet and physical exercise, but it was really trying to look at health in a broader sense and having somebody in there as a champion. Sexual health studies. So wellbeing education and health education is within this part of Maslow's pyramid to prevent and to protect against illness and injury. But the efforts to provide sexual health education can also have mixed results. And, in a mixed classroom, for example, there can be inequalities resulting around gender, and also for young people, LGBTQ disparities, that the way that, really brought up in the kind of cultural orientation to sexual health education, perhaps some of the terms that are used, the way that teachers deliver it, all of those can actually increase disparities. Some more specific interventions here. Swimming interventions did not reduce health inequalities, according to one study, but there was a really interesting study about cycle helmets and the instruction about cycling that came with cycle helmets. So it wasn't just about giving somebody a piece of equipment. Again, it was part of something more rounded, and really, did seem to be a benefit for students from low SES backgrounds. But indeed, some interesting studies, fundamental studies, and maybe this is linked to the last speaker's presentation as well, somewhere around language, but Grimminger finding that some of the students from the low SES environment may have different concepts of health. So, for example, they talked about obesity, and obesity among these students was seen very much as the result of bad behaviour. There wasn't really that nuanced idea about structural determinants, commercial determinants that there might have been in the children who come from higher SES families. So, you know, if you've got a student who's starting from that concept that I am obese because I am bad and I did bad things, you know, that if you're a teacher who's trying to deliver curriculum to a mixed group, that, you know, you would need to be mindful of that. And more broadly, perhaps, that cultural bias may be present in current health education, and that might play out as inequalities as well. So, providing school health services can result in mixed outcomes for inequalities. We can see here contact with school nurses was great for low SES students, but there were some studies about dental services that could increase inequalities, and that was generally because the higher SES students got more out of it than the lower. So it widened the gap in that way. Not that there wasn't perhaps another improvement in the lower as well, but the higher SES students got more out of it. And other things we can see here, HPV vaccination, you know, something to be really trumpeted and proud of in the way that that has been incorporated into a lot of schools' programmes. And so generally saying that they reduce inequalities, but girls in rural regions may not get their second dose. So again, a different type of inequality playing in there about, you know, the urban-rural environment, and indeed a vaccination consent challenge more broadly for minority groups within, you know, services that really have, are a flagship for many schools. Love and belonging needs. Okay, so less papers now as we go further up the pyramid. But there were some interesting things about the sense of belonging and perhaps mitigating racial microaggressions. And just one near the bottom here, this 1 hour social belonging school intervention. Okay, so it was actually, it was a college intervention for freshmen from African American youth in the US. It was an hour. And it was basically talking to them as they reached the campus about how some social adversity was to be expected and it would pass, you know, so they might find it difficult to make friends at first or to fit in, but that it would pass. And they found the most amazing impacts in terms of their grades over a long period of time, in terms of their self-reported health, and this reduced the achievement gap. And more to the point, very few of these students could even remember that they'd had it. But the effects of it were playing out for quite a long time. And then racial disparities in the perception of the school climate. Bottiani has done a really interesting couple of studies around, again, the workforce in schools. And I think the really important here is to say that burnt-out teachers are not good at managing, you know, racial tensions and in really appealing to and engaging with a diverse group of students. He talks about, you know, caring school police and culturally responsive teachers, and that, you know, this is one of the main things that we should be looking for. Esteem needs, this is all about respect. You know, it could be a music-based intervention during physical education, implementing a programme, lots of things there that hopefully could promote respect and esteem, but again, fewer and fewer studies. So Didier looked at the ideas of policies, practices, human resources, structures and systems as a way of getting levers among educational reform. And so now that I've taken you on the whistle-stop tour of all these different places where inequalities could happen, I just thought let's look at this slide and feel positive. So if we look at each of these 4 areas, the first thing to say about policies is that inequalities are not inevitable, right? They do not have to be there. We can do things in schools to reduce the gap. The first priority is to have all students in schools and have as few of them out on suspensions or whatever, as we'd said. And that civil society plays a really important role in educational change. It's generally set by what parents think and what the prevailing society thinks. And so, you know, as policies are concerned, we as advocates can work with our communities to be positive about education. In terms of practices, what I love, and I think one of the other presentations alluded to this, that schools, if they have high expectations for students' achievement, this is something, and giving them feedback, this is something, not sort of seeing things as inevitable if they're in poorer areas. Meaningful student participation. I didn't see really anything in terms of, you know, their engagement beyond lessons, you know, in shaping curricula, in shaping activities. But if we can create a wide range of activities with student voice at the heart, then we're going in the right direction. As far as human resources are concerned, we need to attract the most talented staff to the most disadvantaged schools, and they mustn't be burnt out. You know, that it needs a continuous process of pre-service and in-service staff professional development and support. And then as far as structures and systems are concerned, improving school management has a powerful effect, and that's probably linked to the bottom one there about improving school climate. Somebody at the top who believes in their students and believes in their staff and will fight for them, you know, it does have an impact. And then, as we've said, you know, in other presentations, community and parental engagement consistently associated with success. So how can health promotion contribute to reduction? It has a political function, contributing to change. It has a capacity building function. It has a scientific function, exactly what we're doing here, you know, thinking about the evidence base, producing data about policies and practices. And it has a technical function to support schools and communities, to give them ideas for programmes. And indeed, I'm delighted that the chair has carried on working in CRESPACA on a programme called KitCap. And I'll make sure when I make the slides available that I put some links on there. And that's where you can find the French version of the report with all the references. So, schools have the potential to reduce health inequalities. The relationships are complex, but thinking about those levers for change could give us some ways forward. And thank you very much for your time. And we have some social media things there about the chair. Do join our community through one of our websites if you wish. And thank you very much for your welcome today.
Thank you, Nicola, for this talk, and I think a very interesting approach of using the Maslow pyramid to explore the different ways in which we can also look at inequalities. Are there any questions from the public? Not that I can see now. Perhaps I have a... Yeah, it's late. Perhaps I have one question. Intervention-wise, as Maslow says, the basic needs should be met first before you can think of the higher order thing. So, should we start targeting, I don't know, the water, these things that you mentioned, or would that work within that school setting and the inequalities, or do you have other suggestions? Where should we tackle these health inequalities within schools first?
Thanks. It's a great question. I mean, one thing about the pyramid that Maslow talks about is that the bottom four layers, as you meet those needs, the needs reduce. Okay, so as you meet the needs for food, you know, it doesn't have. But the thing about the top of the pyramid, the self-actualization, which is actually where the learning happens. How can I not talk about that? Thanks for giving me the opportunity. Is that is self-propagating. So if you've met everything else, then as far as the learning is concerned, they'll just want more and more. Whereas for everything else, once you've met all these needs, you know, sort of like they can move on and focus on something else. So I think fundamentally we do have to go to the bottom of the pyramid. I think there are some students who do not feel safe walking to school from their house, you know, do not have appropriate clothing, you know, and do not have sustenance and do not get enough sleep. I must admit, as my health career has gone on, I think sleep is the root of pretty much everything and is, you know, related to a lot of the things that you might want to talk about around screen time and things like that. So yes, I think we do have to work at the bottom, but I think we have to be mindful of respect and esteem, because I think that's something that drives a lot of young people's behaviour, even things about like knife crime, and, you know, sort of like, and acting out, you know, sort of like, and disruptive behaviour in schools, is that they're looking for ways to get respect where perhaps they don't get it from other places. So if we can, as we're working through these needs, as we can just make sure, you know, one of the things, when Sharon asked a question earlier about bullying and about what we could do, I believe, in the kind of broader school setting, and two things came into my head at that point. Back to the toilets. Okay, we've got to sort out school toilets. The other thing we've got to talk about is role model teaching, you know. So if we have teachers who teach in bullying ways and don't show students respect, then it's very unlikely, or it's very likely, that that is going to be reflected back at them and that that's going to play out in the classes as well. So again, one of my arguments for why human resources and capacity building, where I think health can support teachers, but needs to make sure that teachers feel empowered, feel that it's coherent with the rest of the things that they do in school, that health isn't something that the biology or the games teacher just gets stuck with because they weren't at a meeting where it was discussed, you know, that everybody's got to take on basically that good health means good education, and they're totally linked together and mutually beneficial.
Thanks very much. It struck me your comment on burnt out teachers and things like that. And we've been looking at some of the funding for schools in England in a similar way to some of the work I presented earlier. But it's clear that there have been huge reductions for I think it's the second biggest government budget after health, and you see exactly the same pattern in terms of reduction. So it's disadvantaged schools in the north of England, particularly. London's been relatively protected.
Yep.
That those are the schools where the educational attainment gaps are biggest, and that those are the schools where the teachers are burnt out, the toilets are awful, etc. So
right.
again, I guess it's just making the point that, you know, these things are structural to a degree.
Absolutely. And this idea of turning it on its head so that you get the most talented teachers going to the most deprived communities is one of the arguments. Yeah.
Thanks so much, Nicola. And it's just so impressive looking at all the literature you've looked through. But I can't resist asking you the same question, which is everything you've said would suggest schools are actually not fit for purpose.
Right.
and I wonder if you've had some thoughts about what schools might look like if they were more fit for purpose and actually could deliver on educational and health inequalities, because we have, you know, both health and educational inequalities for children, and what they might look like if we didn't have to have the way they are at the moment, which is essentially headed by an educationalist, delivered totally by educationalists, and pretty much organised around an educational paradigm. But if in fact they were kind of multi-opportunity communities, what might they look like, and whether any of your work gives us some suggestions?
Yes, absolutely. And we have tried to lay out some of our ideas in the Lancet article, and now I'm going to drastically rack my brains for some of those things. So I think that the connection between education and health should be more apparent in schools. I think that if we're talking about inequalities, that a group that have significant inequalities are, for example, children and youth who live with a long-term condition or more. And you know that there are many of them in each classroom, but many of the conditions are invisible. And so one of the things for me is having good teams wrapped around those students, you know, but also to reverse the kind of decimation of the school health workforce that has happened, certainly in my country, and I think many others over the years. I have a pharmacist colleague, and I've done some work in schools myself as a pharmacist, where we've gone in and looked at inhaler technique for asthma. We've managed to get families in to talk about it. So I think a more overt partnering of local health professionals with educationalists would reinforce that link between, you know, if you're healthy, you can learn, and if you learn, you've got a much better chance of being healthy over the long term and having better outcomes for your families. So I think maybe, you know, if you're looking at the school management team, that, you know, that obviously, you know, educationalists are there and set the tone, but, you know, maybe more cementing of the community aspects to it. And again, you know, people in knowledgeable positions about health would be good at the top, you know, to sort of set the tone. There are very good frameworks that are out there that have been promoted by UN agencies and others, and I don't think it'll be one size fits all, but I think that the fabric of the school possibly has to change, the size of our schools possibly has to change, you know, smaller classes, you know, but that takes more people. So it's a bit garbled. I'm sorry, it's been quite a long day and a lot to digest, but I think that there are some fundamental ways in which we could move schools forward.
Thank you. I just have one question here and a last over there, because I've also been announced that we need to evacuate the room, not for the fire alarm, but for another group that comes after us, well, before 6 o'clock. So.
Very quick. What about children with disabilities?
Yes, absolutely. No, I think it's a huge issue. Again, these are children who spend a lot of days out of school. It was interesting about the pandemic, you know, that I think overall the pandemic was quite negative for children with disabilities and children with long-term conditions, that they were kept at home quite a lot, and, you know, even more than other children who were able to go to schools that were open. But I do wonder whether we learned something in the kind of remote learning adaptation that had to happen during the pandemic that could be put to good use for children who do, for example, have to spend long periods of time in hospital, you know, or in the home environment. But there are huge inequalities for students with disabilities. If you think about the fabric of schools, the layout of many schools, you know, stairs, for example, for those who aren't mobile, or having clean and private places to inject your insulin or to, you know, do your blood monitoring, that schools are not built for children and youth who have disability and long-term conditions, and that should change.
Thank you. And actually, it was also the last question. So thank you again for your presentation.
Pleasure.